Hi, this is Amity Overall-Laid with NORC, and welcome to today's webinar. This webinar will review the revised Part 3 training materials for the National Ombudsman Reporting System, or NORS, about complaint, verification, disposition, referral, and closing cases. Attendees include state ombudsmen and representatives of the Office of the State Ombudsman. Representatives of the office, often called local or regional ombudsmen in states, are our target audience today. Today is the fourth of 5 webinars created specifically for those of you in the field who provide direct ombudsman program services. Our speakers today are myself and Louise Ryan, Ombudsman Program Specialist, Administration on Aging, Administration for Community Living. Attendees are muted. If you have any questions, please submit those in the control panel on your screen. We will address some questions in between quiz questions and more at the end of the webinar. Next slide. Today's agenda includes a few remarks from Louise on behalf of ACL, a review of Part 3 training materials, a review and participation in taking the quiz, general Q&A, and a reminder of resources available through the National Ombudsman Resource Center, or NORC. For today's webinar and the rest of the series, we are focusing on the basics of NORS reporting. Due to the NORS data collection changing effective October 1st, we updated our training materials. The purpose of these webinars is to review the new training materials and talk about the basics of reporting to improve reporting consistency. Next slide, please. And with that brief introduction, I'd like to turn this over to Louise Ryan, Ombudsman Program Specialist, Administration for Community Living. Thank you, Louise.
Thank you, Amity, and welcome everybody. Can I have the next slide? I just want to remind you all about the purpose of NORS, and NORS, the National Ombudsman Reporting System, which has been around since 1995, and this is our kind of big overhaul of the NORS data collection. And it fulfills the Older Americans Act requirements, and also we use it in a variety of ways. For instance, at the federal, state, and local levels to help inform policy. ACL uses it for budget justification. We also use it, as you do, to educate the public, and state ombudsmen also use it as a program management tool, and we also use it that way at the federal level. But most important, and I'm going to keep hammering away at this one, NORS is the only data collected that represents the concerns and problems experienced by residents. And I want to thank you for the work that you do with residents and for your documentation of that work. This is not collected elsewhere. And the Ombudsman program, being the only program focused on the health, safety, welfare, and rights of residents, it just makes it all the more important that you document that, and so it's just, I'm going to hammer away at that. And so we'll go on to the next slide. And I hope to not sound like a broken record, but I'm going to just again repeat a few things. So NORS and the goals of what we call the new NORS, it's still NORS, but it's new and different. And some of the goals for this new NORS was to simplify the complaint codes and also the disposition codes and just some of the other data elements. And for doing that, we hope that it will increase the reliability and accuracy of the data, and also to improve our understanding of the problems experienced by residents. We really hope to get a better sense of ombudsman program operations, and also to get a sense of what's changing in long-term services and supports. And parallel to the changing of the NORS, we've also changed the software that state ombudsmen will report into. And so our new software, called the Older Americans Act Performance System, or OAPS, this new software will be much more flexible in terms of the ability for ACL to analyze complaint data. And what I want to emphasize here is that it's more important than ever that you enter all of your work into whatever software system you use at the state level, because state ombudsmen will no longer be able to just manually type in their data into the current reporting system that we have. They will have to upload a case and complaint Excel or CVS or CSV table, some type of a table of their data, complaint and case data. And so if you are late in documenting or late in closing out cases, and then the state ombudsman reports what the state has done, and if you haven't completed your work, it will not be included in that year's report. So it's a bit of a shift, and so throughout the year upcoming, I'll be emphasizing with state ombudsmen about how to make sure that you're, as a day-to-day person out there doing the direct work, how you keep tabs and keep up with your data entry. And if you're managing volunteers and their work, that would include their work as well. So just want to emphasize that. And again, just go back to that message that not documenting what you do is sometimes silencing the problems that residents experience. And again, the data that you provide us is the only data that represents the concerns and problems experienced by residents. So thank you again for the work that you do and for the documentation that you do. You know, we use the NORS data at ACL regularly, whether it's talking to the media, explaining things to Congress. So that complaint data is very, very important. So thank you again. Next slide, I'm going to turn it back to Amity.
Thank you, Louise. All right, so similar to the current NORS training materials, the documents are the basic principles, a quiz, and the quiz answers. However, for part 3, there's an additional resource called Closing the Case. For the quiz and discussion today, please refer to the 4 documents that we sent via email and that are available as handouts in your toolbox. You will also need the ACL NORS tables 1 and 2. And just so you know, the training materials are also available in black and white on the NORC website with the NORS tables. The slides and recording from today's webinar will be included on the website with these materials, so programs can use them for training months before implementation of the revised NORS. And you will note on the slide that the NORS codes and definitions used in all of the NORS training materials, part 1 through part 4 that you'll learn about next month, are taken directly from the ACL tables 1 through 3, and they are not to be modified. Next slide, please. So each part of the revised NORS training includes a basic principles resource with important explanations and reminders. So let's get started with the basic principles for part 3. Similar to the current NORS, verification is a confirmation that most or all facts alleged by the complainant are likely to be true, and each complaint must have a verification status, and that status would be either verified or not verified. Next slide, please. Ombudsmen always attempt to determine the facts of the complaint as part of the complaint investigation process. The Ombudsman investigates and works to resolve complaints on behalf of one or more residents for purposes of resolving the complaint to the resident's satisfaction and to protect the health, welfare, and rights of the resident. Ombudsman must support and maximize resident participation throughout the entire process of resolving the complaint and follow the direction of the resident. As a few of the quiz questions we'll address later in today's presentation, Ombudsmen continue to work with residents to resolve the complaint to their satisfaction, even when the complaint can't be verified. There are times when the facts presented in the initial complaint cannot be verified. However, that doesn't mean that as standard practice, the Ombudsman program just stops any complaint investigation activities. More often than not, there are steps you can take to do your best to ensure that the resident feels like they've been listened to and supported and are satisfied with the resolution. Next slide.
Amity, there's some feedback that you're a little bit hard to hear. So could you get closer to the speaker or microphone? Thanks. Much better. Thanks.
Great. Thank you. Sorry about that. We did do an audio test earlier, but glad to know, and thanks for letting us know. So, basic principles about disposition. Disposition is the final resolution or outcome of a complaint. You may perform many activities when investigating and resolving a complaint, but there's only one outcome. Each complaint must have a disposition code, whether the complaint is verified or not. Next slide. The number of disposition codes, meaning the final outcome of the complaint, were reduced from 7 in the current NORS to only 3 codes, and those are partially or fully resolved to the satisfaction of the resident, resident representative, or complainant, withdrawn or no action needed by the resident, resident representative, or complainant, and not resolved to the satisfaction of the resident, resident representative, or complainant. When choosing a disposition code, you always need to follow the direction of the resident, and we'll speak to how to proceed if the resident can't communicate his or her satisfaction on the next slide. Next slide, please. When a resident is unable to communicate his or her satisfaction, the Ombudsman may rely on the perspective of the resident representative, as long as the Ombudsman has no reasonable cause to believe that that representative is not acting in the best interests of the resident. When the resident is unable to communicate his or her perspective and does not have a resident representative, the Ombudsman shall determine whether the complaint was resolved to the satisfaction of the complainant. If a resident dies before the investigation is complete, the Ombudsman may look to the resident representative, if available, or the complainant to determine the complaint disposition. If the Ombudsman was the complainant and there is no representative, then the Ombudsman shall determine the disposition. So just so you know, this is based on the requirements in the Ombudsman rule regarding complaint processing. Next slide. Identifying a referral agency code is new in the revised NORS, as referring a complaint to another agency is no longer considered a disposition. Referral agency is defined in Table 1 as the agency or agencies to which a complaint was referred to as part of the Ombudsman Program's plan of action for complaint resolution, such as referrals to state licensing and certification or adult protective services. Every complaint must have a referral code. If there was no referral, use code no referral was made or 06. You may have more than one referral agency for a complaint. And as you can see, there are 7 referral agency codes. 01 for licensing, regulatory, or certification agency, 02 for APS, 03 for law enforcement or prosecutor, 04 protection and advocacy, 05 legal services, 06 no referral was made, or 99 for other. Next slide, please. In regards to basic principles for closing a complaint and a case, each case can only have one case close date. Each complaint can only have one complaint closed date. And you will close the case after completing all actions on all complaints within the case and ensuring that every complaint within that case has an appropriate referral code, verification, and disposition code. Next slide, please. So as you may remember, we did discuss this in the last webinar, but thought this was a good refresher since we're talking about coding complaints and cases and closing cases. We have received several questions about when to code a complaint. So for example, do you code it when you receive it initially? Maybe a family member contacts your office with a concern, or do you code it after you've spoken with the resident and received consent to investigate the issue? As defined in the revised NORS, the definition of a complaint is an expression of dissatisfaction or concern brought to or initiated by the Ombudsman Program, which requires Ombudsman Program investigation and resolution on behalf of one or more residents. The NORS tables and training materials do not speak to when you assign a complaint code to a problem, and there has been variation among state programs. To improve reporting consistency, we do recommend that you assign complaint codes at the time that the complaint is received based on the problem or problems and how they're presented by the complainant. For example, if a family member contacts your office with a complaint, the family member is the complainant, and you would assign complaint codes immediately based on the concerns shared by that family member. When you go out to visit the resident for consent to investigate and to see if they have concerns that align with a family member, if the resident agrees with those concerns, gives you consent, and shares additional concerns, then you can add more complaint codes for those concerns. Conversely, if the resident does not agree with a family member and asks you not to proceed, you would close the case as withdrawn or no action needed, meaning that the program, you, still had a complaint, and it might still be legitimate, but in order to honor the resident's preference, you don't take action, and that's how you would code it. So next slide. Before we move to the quiz, we do have a few minutes to take questions about what we just shared about the training materials and kind of the basics of this part. So if you have questions, please enter those in the toolbox. And I will pull them out and see what we can address. Okay, so let's see. So one question was, I'd like to revisit the definition of verified when there's a chance. Okay, thank you so much. So let me pull that up. All right. So Katie, if you could go back to slide 7. So thanks for asking this question. The definition of verification is very, very, very slightly different than the current version of NORS. The current version says verification is confirmation that, and I'm not looking at that document right now, but that all facts are generally accurate as reported by the complainant. So generally accurate is the difference in the current definition, and the revised definition is that those facts are likely to be true. So again, very slight difference, and it doesn't necessarily change the procedure that ombudsmen take in trying to determine whether those facts are true or not and whether to verify that or not. So I hope that that answers your question. If not, we can certainly take more. So another question, and a good one as well, is what would we use code 99 other for in referring to the referral agency? That would simply mean that you referred it out to some entity that doesn't fall along those other codes. And Louise, is that you?
Yeah, so
Yeah.
maybe
Okay,
an example could be, maybe you made a referral to a housing agency or a social service agency to get help to resolve the problem. So it's not on this list of agency codes, and that's why you'd select other, and then, you know, just a 2-word description. Thank you. So another question, did you say that every complaint must have a referral code? Yes, we did say that. And as you may remember from that slide, it says, oh, never mind. Thanks, Katie, you're already on it. There is an option for no referral was made. So yes, you do have to enter a referral code, but obviously that doesn't mean that you have to refer every complaint to an outside entity. Hope that helps. Okay, let's see here. What is the difference between referral code 2 and 4? 2 is adult protective services and 4 is protection and advocacy. Those are 2 separate entities. Adult protective services investigates elder abuse or abuse of older adults, and protection and advocacy is a separate entity that advocates for individuals with disabilities. And Louise, did you want to say something to that? Because I hear you. Sure. You may know of protection and advocacy. They might be called disability rights in your state. And like the Ombudsman program, every state has a protection and advocacy, and they have specific federal laws that help to guide the program in a similar way that the Ombudsman program has federal laws. So they may not have a lot of staff, or like they may not have volunteers, so they might be lower profile in your state, and sometimes they might focus more on systems issues rather than the level of individual complaint work that Ombudsman programs do.
Thanks, Louise. So another question, is there a difference between withdrawn and no action needed? Yes. So to give you an example of that, say that you're out on a facility visit, and we'll get to this in the quiz questions too as an example, but a resident complains about something, you discuss it, you're going to take action with that resident's consent, and maybe it involved a phone call to the corporate office, and before you could make that phone call, the resident said they changed their mind for whatever reason. They don't want to fight that battle, or some other reason, but the resident or whoever the complainant is withdraws their complaint and says they don't want you to move further with it. So no action needed would be like that example that was given of the family member contacting your office. You go out and visit with the resident. The resident says they don't want you to take action. That would be no action needed. The reason that wouldn't be withdrawn is because it wasn't withdrawn by the initial complainant. It is very possible that the family member wants you to still move forward with that, but as an Ombudsman program, you're going with the resident's direction, and so it would be no action needed. I hope that helps.
Just all right. To clarify though, Amity, we have, because it's so sometimes difficult to determine, was it withdrawn, was it no action needed, we've merged those two together. So that is, so just as a reminder, there's only 3 disposition codes now. So when we look at the federal level and the NORS codes, withdrawn or no action needed is combined. So you may know for a fact that it was withdrawn, or you may know that it was no action needed, but in terms of the NORS code, it's one code. So.
Thank you. So 2 more questions, just because I want to make sure we address these and don't get lost in the quiz questions. So someone asked, to make sure they heard it correctly, the fact that the resident confirms the issues of the complaint does not necessarily mean the complaint is verified. And yes, that's correct, because sometimes the resident or complainant or whomever will file the initial complaint with your program, then you go to investigate it, and the facts that you find don't necessarily back up what was presented in the original complaint. Now, that doesn't necessarily mean that the resident's perspective and how they felt may be wronged or betrayed, or that their rights were not honored. That doesn't mean the resident is wrong. It just means that the facts of the case are not supported, and so it would not be verified. And that's kind of what I was speaking to in the initial slides, that just because it's not verified, there are oftentimes actions that the Ombudsman program can still take to support that resident and to ensure that they feel like they were listened to, and they get the answers they need, and oftentimes may even be satisfied with the resolution. So, and we'll get to that in the quiz questions, and I hope it'll be a little bit clearer. So this final question I wanted to address, you mentioned for verification that it's based on the complainant, and the question said, did you mean the resident? And yes and no, and Louise, feel free to jump in. But verification, again, you're trying to see if it's verified and if the facts provided in that initial complaint are likely to be true, basically true, etc. So the complainant could be the resident, it could be a family member. You could, once you go visit the resident after the complaint was received, perhaps the resident gives you even more information, about those concerns, and then you try to find out if that information is factually true, and then you verify it. So it's really not specific to a person, it's specific to the facts as presented in the complaint. So I hope that helps. And Louise, feel free to supplement that if you'd like.
Well, I think it gets back to the idea that, you look to verify is what you find accurate, generally accurate or true, and then what does the resident want to do about it, right? So those are kind of two different things. And it might be, yes, there's a true actual problem here, but then the resident doesn't want to, maybe doesn't want to take action. So there's kind of figuring out the facts of the issue, and then there's the consent of the issue. So, those are kind of distinct items. I hope that's helpful.
Thank you. And yes, and again, we're talking about verification in that part. So one more question. I know I said only one, but these are really good, and I want to make sure we don't lose them. Someone asked, referral only with consent, ? And yes, of course. So again, going back to Ombudsman program, complaint investigation procedures and requirements, you have to check back in with the resident throughout the complaint investigation and resolution process, and obviously have consent, which includes consent for referral to an outside entity. So good question, and thanks for the opportunity to reiterate that. So with that, let's move to the quiz, because I think these quiz questions hopefully will answer some of your questions that have been coming in, and if not, then I'll do my best to go back and address the questions. So thanks, Katie. Okay. So to assist with the quiz, if you haven't, hopefully you've taken it already and you're coming to this webinar with your answers. But if you haven't, whenever you're taking this quiz, you'll definitely need to use the NORS Table 1 for complaint, case and complaint codes, values, and definitions. And you'll find the definitions of the referral agency's verification and disposition in NORS Table number 2. And again, if questions arise when you are taking this quiz or when you're training others that are taking this quiz, please refer back to tables 1 and 2, as well as the training materials that we're discussing today. So for this quiz, for each of the scenarios that we're going to discuss, you'll be asked to identify the complainant, the complaint codes or code, verification status, the disposition, and the referral agency code. And as a reminder, for purposes of this training, assume that the resident gives you consent to investigate if not otherwise indicated. So just to also give you a heads up, since we're using GoToMeeting and the webinar platform is just limited in how we can ask quiz questions, for each of these scenarios, even though we're asking you to identify all 5 of those areas, the complainant, complaint codes, and so on, we won't actually be able to quiz you on that. So what I'm going to do is review the scenario and then review 4 of those 5 answers, and then ask you to take the quiz or the poll question for that 5th answer. So, and it won't always be the same answer. So you'll see that going forward, but just wanted to give you a heads up for that. That's why we had to do it this way. So next slide, please, Katie. Thank you. Okay, so our first scenario, a nursing home resident complains the facility is keeping her money. They're ripping me off, she states. You talk with the business office manager who tells you that the resident asked to have her own phone. She agreed at the time to pay for the phone out of her personal needs allowance, or P&A. She uses the balance of her P&A to have her hair done and purchase a few personal items throughout the month. You report that back to the resident, and she forgot that she was paying for the phone out of her P&A. She's glad that you straightened things out. She really likes having the phone because she can keep in touch with her children and her friends. Next slide, please. So for this scenario, the complainant is the resident. The complaint code is E02 for personal property. The disposition is 01, partially or fully resolved. And there is no referral code because you didn't refer it out. I mean, there's no referral agency because you didn't refer it out. So that would be coded as 06, none, or no referral made. So our poll question to you is the complaint verified? So in just a second, if you could answer that poll question. Great. Thanks, Katie. If you could go ahead and close it and show the results. Excellent. So 66% said not verified. So next slide, please. The 66% of you are correct. It's not verified. So this is an example that goes back to what we talked about in those first slides about the fact that the facts alleged in the initial complaint are not true. The facility was not stealing her money as she thought. Therefore, the complaint is not verified. However, even though the complaint's not verified, it still required action on the part of the Ombudsman. After investigating the complaint, the Ombudsman discovered the facility's not keeping her money. They were paying for the phone that the resident requested. So no referral to another agency was required, and the case can be closed because there was nothing more for the Ombudsman to do. All right, next slide, please. Thank you. Scenario number 2. Ms. Douglas's son complains that the nursing home is refusing to take his mother to the dining room for lunch. He tells you that he's talked to the facility several times, but when he calls at noon, his mother's always in her room eating her meal. You visit Ms. Douglas and explain the call received from her son. She tells you she likes to eat lunch in her room because it's quiet. It's the only time she gets to be alone. The aides always try to take her into the dining room at noon, but she tells them no. She does share that she eats dinner in the dining room. Next slide. So for this scenario, the complainant is O2 for the family member, the son. The complaint code is D09, other rights and preferences. The complaint is 02, not verified, and the referral was made and is coded with no referral was made and is coded as 06, none. So for this scenario, what is the disposition? Next slide. So you need to choose the correct answer for the disposition, partially or fully resolved, withdrawn or no action needed, or not resolved. Thank you, Katie. And I do realize that I skipped right over scenario 1 without looking at the questions panel, so I'll do that now. Okay, go ahead and close that. Thanks, Katie. So it looks like 81% said withdrawn or no action needed. So go to the next slide, please, Katie. And again, that 81% of y'all are right. So great. The correct answer is O2, withdrawn or no action needed by the resident, resident representative, or complainant. The facility is not refusing to take Ms. Douglas to the dining room. She simply wants to eat in her room. Therefore, the circumstances described by the son are not accurate and the complaint is not verified. There's nothing more for the Ombudsman to do because the resident does not think there's an issue. So if you'll give me a second, I'm going to go to the questions and see if there's any questions about scenario 1, since I forgot to do that. My apologies. And now scenario 2. So just 1 second, bear with me. And feel free, Louise, if you see some questions while I'm looking to address those. Okay, so it looks like most of the questions are about actual complaint codes. So let's see, scenario 1, why isn't the complaint code A04 about financial exploitation? So just 1 moment. It was E02, personal property. So if y'all give me 1 second, I'm just going to look at the definitions of these codes and then I can answer that question because believe it or not, I don't have them all memorized. So at least not yet. Okay, so the reason, and that's a great question, I can see why you would ask that. So again, like we've talked about before with these complaint codes, because I know we're all going to take some time and it's going to be some growing pains getting used to them. You have to refer back to the definition and then the examples and reporting tips. So looking at E02, The definition for personal property is loss or mismanagement by the facility of resident property, including residents' money or trust fund. Used for loss of personal items, if the facility staff withholds or damages resident property, failing to reimburse the resident, etc. So it's a very that's a great question because it's a slight difference, but the difference here is that the complaint was she felt that they were stealing her money or misusing her money. So in the examples and reporting tips, it actually says use AO4, financial exploitation, if improper use of property or money is for the benefit of others. So the definition of financial exploitation is that someone is using it to benefit themselves. And so in this case, the definition for mismanagement or loss, which includes residents' money, was closer to the original complaint or issue. So I hope that helps. Okay, and number 2, why is it not HO2? Okay. So the definition for HO2, which the label of that complaint code is dining and hydration, is that facility staff fails to assist with dining or ensuring adequate hydration or similar complaints. And that the examples and reporting tips says that the facility has not provided adaptive equipment so they can maintain their independence in eating, including providing fluid and reminders or assistance to stay hydrated. So this was more of a complaint that they're not, physically either assisting at mealtime with hydration or eating, or providing the equipment to do so, not supporting her choice to go to the dining hall. So that's the difference between those two. Okay, so good questions. Let's go ahead and go back to the slides. So scenario 3, Katie, please. Let me get back to mine too. Thanks, y'all. These are great questions. And like I said, we'll try to address as many as we can and then go back and address those that we didn't quite catch. So scenario 3, a resident's daughter complains that her dad is not allowed to have his cat in his room at his residential care community. You visit the resident at the facility and he says his cat means everything to him and he wants to keep him in his room. You review the admission agreement and policies and find nothing in writing that limits pets living at the facility. He brought his cat with him when he was admitted months ago, and now the administrator is saying that no pets are allowed. You speak to the administrator and try to work out a solution for the resident to have his cat. The administrator states that the other residents and staff are allergic to the cat. No pets are allowed in the building. You obtain consent from the resident to make a complaint to the licensing agency, and the report comes back unsubstantiated. The resident and his daughter appreciate your advocacy, and they begin searching for a pet-friendly home. Next slide. So for this scenario, the complainant is O2, the family. The complaint code is D09, other rights and preferences. The complaint is verified, and the disposition is O3, not resolved. So our question to you in the poll is, what is the referral agency code? And please note to our limitations in this webinar that we could only ask for 5 of the agency codes, not all 7. Okay, it looks like most have responded, so we can go ahead and close that and share the results. And 91% of you all said O1, licensing, regulatory, or certification agency, and that is correct. Great job. So again, I'm going to go to the question box, if you'll bear with me for a second and see if we have any questions about this. So someone asked if there's a printout of the codes for easy use before having to enter this into the system. And yes, if you print out the table 2 of the complaint codes, then that would be really helpful to use before entering into the system. And that's a great question, because we also are going to have for you all, once this webinar series is done, as kind of part of our ongoing technical assistance, we've developed a one-pager that has a shorter version. It lists all the complaint codes and the complaint label, basically the name of the complaint, and it's a little bit shorter. So once you get, we encourage you to use the table number 2 first until you get really, really comfortable with those definitions and the examples and reporting tips, because as you've already seen today and in the last webinar, there's some that are kind of in that gray area. So use that table, and then we'll kind of have that supplement one-pager out in the coming months. So thank you.
Amity, there are several scenario 2 questions.
Thank you. Okay, so for scenario 2, why wouldn't the complaint code be D05, since the son complained his mother wasn't being taken to the dining room, even though she didn't want to be taken? All right, let me go back to 2. D05. Sorry, y'all, I'm trying to multitask as fast as I can between pages, so bear with me here. I appreciate your patience. Okay, so good question. So the definition for D05, the label is response to complaints. So the definition of that is facility staff ignores or trivializes a resident complaint, or there's no facility grievance process, therefore limiting the resident's ability to resolve a problem. So the reason that code wasn't used for that example of not being brought to the dining room is that the facility wasn't ignoring the resident's request to go to the dining room. And the facility wasn't ignoring, the son's complaints about anything. But so that's why that code wasn't used. Hope that helps. So, and then D09, the definition of that code is depriving of any right not defined in D1 through D8, such as personal liberty or freedom of choice, which again, that would be her choice to not go to the dining room. So really good question. Thank you. Okay, so let's see. Scenario 2, what if the son is the power of attorney and the resident's described as being confused and having dementia? Is it still not verified? Could you talk a little bit about how the legal relationship surrogate decision making may impact different codes being selected? Okay, so that's a big question. So give me 1 second to go back to that. And Louise, feel free to chime in as I'm scrolling through my slides.
Yeah, I'm trying to find this on the question queue, but I think, the resident, for one thing, you'd want to see, well, what does that durable power of attorney say in terms of being able to make decisions for the mother? And it probably doesn't have a level of detail about how they choose to live their kind of day-to-day life. So that would be one thing you'd want to take into consideration. And then you want to look at, well, what can the resident express? Can they say, I like having lunch in my room? And they don't say a whole lot else, but they can say that. Or maybe they're not very verbal, but the facility staff, you get consent to look at the records and you say the resident eats all of her lunch, every drop of it. And then at dinner, she doesn't eat as much. So that could be another indication of, that having lunch by herself in her room is a good thing for her. So just some quick examples.
Thank you. Okay, good questions. Let's go ahead and move to, let's see, what number are we on? 4? All right, yes, 4. Thank you, Katie. All right, for this scenario, a resident tells you that an aide stole his family Bible. You speak to the aide and she explains that she put it in his top dresser drawer. It has a leather and gold cover and she put it away for safekeeping. You tell the resident the Bible is in the dresser drawer. He explains that he still cannot get to it because he's unable to walk across the room and would like to read it every morning. You address the matter of the location of the Bible with the staff, and the resident now has easy access to his Bible. Next slide, please. So the complainant is the resident. The complaints are E02, personal property, and D09, other rights and preferences. The disposition for both complaints is 01, partially or fully resolved, and a referral was not made, so the code is 06, no referral made. So our question to you in the poll is, were the complaints verified? So as you can see, since there were two complaints, there's two options, and both verified or one not verified and one verified. Okay, thanks, Katie. I think you can close that. Now let's look at the answers. So 71% said E02 is not verified and D09 is verified. All right, so go ahead and go to the next slide, please. Thank you. And again, you all, the majority are correct. So the reason the first one is not verified, as you'll remember, that complaint was that the staff stole his Bible. Come to find out after you look into the facts, the staff did not steal the Bible. However, the Bible was moved. So the circumstances that the resident described in the initial complaint, that it was stolen, are not factually true. So the complaint E02 is not verified. However, the staff did not consider the resident's preferences or limitations in accessing his Bible and needing it close by. So the Ombudsman addressed that concern as well, and that was certainly verified. So let me take a moment and see if there are any questions about that one.
Amity, I'm going to start putting them in the chat for you to be able to find them quicker.
Thanks, Carol. I think I'm okay. It just takes a little while to read them, but anything that you think is helpful is great. Thank you. All right. So E02 is not verified. If a complaint's not verified, how can you resolve it? So good question. So as we talked about earlier, even though the facts may not be factually true, you're still looking for the resident satisfaction. So in this situation, the facts were not true. The staff did not steal the Bible. They moved it. Once that was explained to the resident was satisfied with the fact that it wasn't stolen and satisfied with that resolution. However, the resident shared another concern that they couldn't access it where it was moved to. So the Ombudsman addressed that and resolved that issue. So good question. Thank you. Okay. So that's all I see for that one. Thank you. All right, let's go ahead and move forward, Katie, to scenario 5. A person calls complaining that her friend, a nursing home resident, needs to be moved to a room closer to the nurse's station because she feels isolated at the end of the hall. The friend has a healthcare durable power of attorney for the resident. The resident agrees that she would feel safer in one of the 2 rooms near the nurses. You investigate and find that there are no empty beds in either of those rooms. The friend, who's also the durable power of attorney, insists that they move one of the other residents to make room for her friend. You visit the resident twice, and she tells you she wants to forget the whole thing. Her current room is fine, and all the commotion about moving is upsetting to her. Next slide. The complainant is O2, resident representative. The complaint code is C04, room issues. The complaint is 01, verified. A referral was not made, so the code is 06, none. And our question to you in the poll is, what is the disposition? So if you could answer that poll question, please. Great. Go ahead and close that, Katie. It looks like most have responded. And 93% of y'all said withdrawn or no action needed. Go ahead and do the next slide, Katie. Thank you. And that answer is correct. That was withdrawn by the resident. As you heard, the resident was upset about just all the commotion and didn't basically want to move this forward. It was too stressful for her. So the complaint, it was verified, especially because the facts were she was far away from the nurse's station. The resident agreed initially and wanted to move. Both the resident and complainant agreed that they preferred a room closer to the nurse's station. However, you, as the ombudsman, followed the resident direction to stop action on that complaint. So even though the friend is the resident's legal representative, you received very clear direction from the resident that she didn't want to proceed. All right. So it looks like there was a question to go back a little bit on number 4. Okay. The initial code or the complaint code chosen was E02 personal property about the Bible being stolen. And the question is, shouldn't it be, if someone stole it, it would be for the benefit of another, using the A04 definition. So again, going back to that one, it was the loss or mismanagement of the resident property. And A04, that would be financial exploitation is for A04. Again, individuals, funds, property, or assets. So that's really assets. And property in this situation, unless I'm mistaken, and Louise, feel free to correct me, but this definition for financial exploitation, property means property, like building, land, someone selling the resident's house without permission once the resident was in the facility, not a Bible, because that doesn't have any monetary value except, I guess, stealing the leather case and the gold. So hope that answers your question. So back to scenario 5. Question was, I'm not clear on what the complainant is alleging the provider actually did wrong. Good question, but the complainant is basically saying that the provider needs to move the resident closer to the nurse's station, that she's too far away. So I guess it's not necessarily that they did anything wrong. I'm assuming, again, for the purpose of this training, we're just basing it on the scenario that we have in front of us, but perhaps the person that called the power of attorney had already asked the facility to move the resident and the facility didn't, and so now they're reaching out to the Ombudsman program. So another question, why wouldn't I ask the administrator to change her room when space is available? I think that's a good question, and that's probably what the Ombudsman would do once space was available. But I think what happened was, as the Ombudsman investigated it, found out that those rooms were full, that there wasn't availability, then the resident just wanted to drop it at that point and didn't want to pursue it further. Had the resident wanted to pursue it further, then certainly I think that would be a normal course of action for the Ombudsman to ask them to move her once that becomes available. Good question. And yes, another question, which is exactly why the Ombudsman, didn't advocate to move another resident out of their room. The question was, isn't it against the rights of other residents to just move them to another room to get another resident the one they want? Absolutely. Both residents have to agree to that. Good question. So another question about scenario 4, it does not, I love how detailed y'all get. So this is a good example of how you're all great advocates. Quick question about scenario 4, it does not indicate the Ombudsman verified the Bible is actually in the dresser drawer. Yes, I think that's an assumption that can be made for the purpose of this training. We can't, that the Ombudsman actually did verify that before speaking with the resident. So whenever they went back to the resident, I would assume what happened is they said, this is what the aide said, may we check your drawer? They checked the drawer, and then the resident saying, that's too far away from me. So I believe that's how that probably happened. Okay, so good questions. Let's move on to scenario 6. Okay, during a visit at a nursing home, several residents tell you the food is often cold. You observe meal service and visit a few other residents who also report the food is cold. So you open a case on behalf of the group. You speak with dietary staff about the problem. Initially, the mealtime is adjusted to accommodate residents who are engaged in activities, but a few other residents still complain it's cold. You continue to work the case. The Director of Food Services agrees to purchase new heating lamps and to increase staffing during peak times. The management follows through on ordering the equipment, but the staffing has not been increased. You check in with the residents a few weeks later, and all but one are satisfied with the improvements made. Next slide. So the complainant is a resident. The complaint code is food services. The complaint is verified, and there was no referral made, so that is 06 or none. Our question in this poll is, what is the disposition? All right, thank you. Let's go ahead and close that poll and share the results. So yes, 96% said partially or fully resolved. Next slide. And that is the correct answer. The Ombudsman can verify this complaint since several residents confirm the food is cold. The Ombudsman is able to confirm that all but one resident is pleased with the food temperature. The facility did not follow through on additional staffing, but it appears that the heat lamps are at least helping keep the food at an adequate temperature. Okay. Great. So let's see here. I don't see any questions about that one. I think that one's pretty straightforward. Great. Let's move on to the next scenario, please. All right, the resident council president tells you she thinks the personal needs allowance for residents receiving Medicaid is too low. At their invitation, you meet with the resident council and explain that the P&A is determined at the state legislature. The council asks for the Ombudsman program assistance in advocating for an increased P&A. You, the state ombudsman, and the resident council president meet by phone to discuss advocacy options. The resident council is satisfied that the Ombudsman program will seek legislative changes to increase the P&A. Next slide. The complaint is 07, resident or family council, or complainant. The complaint is KO2, Medicaid. The complaint is verified, and a referral. Oh, I apologize. I did not change this answer. So this answer should read, a referral was not made, because we changed this quiz question. So I apologize for that. Our poll question for you is, what is the disposition? Okay, go ahead and close it, please. 71% said partially or fully resolved. Next slide. And that answer is correct. A change in the P&A requires a change in the law. Legislative action will be needed to ultimately resolve this complaint to the satisfaction of the residents. The case can be closed because the Ombudsman has taken appropriate action to attempt to resolve the problem, and the resident council is satisfied that the Ombudsman program has agreed to pursue legislative action. Thank you, Katie. Go ahead and stop sharing the poll results and go to the next slide. Thank you. So I don't see any, okay, hold on, let's see. So and this question just popped up, so I don't know if I missed it earlier. It looks like it was just a minute ago. For the scenario about the food being cold, someone asked, what would you say to the one resident who was not satisfied? Continued advocacy. Yes, since the majority of the residents were pleased and that one resident unfortunately was not, then yes, you could still, advocate, check back long-term, make sure that it doesn't get worse, and then see if there's anything that could help that individual. But as a group, that would be partially or fully resolved. Good question. Question about this last one that we just talked about with the P&A. Why isn't it that it was referred to the state ombudsman since they're going to pursue it? That's a really good question. So, and again, I apologize for that typo. That was part of the previous version of the training materials, and we changed that case. The reason it wouldn't be referred to the state ombudsman program is because you're part of the state ombudsman program. So even though the state ombudsman was brought in on that conversation, it's all one program taking action on that complaint. So good question. Thank you. All right. So let's move forward. Thank you, Katie. Scenario 8. A resident living in a residential care community complains that the home's provider will not let her go to the activity center each day as she has in the past. You investigate and discover that the activity center has reduced the number of days it's opened each week, but the resident was not aware of the schedule change. The provider said she told the resident about the schedule change, but she must have forgotten. You and the provider discuss techniques to remind the resident, such as keeping a calendar in her room with the activity center schedule, and discuss other services in the community that the resident may be able to utilize. The resident agrees to talk to the home's provider and her caseworker about what she can do on the days the center is closed. You check back the next month, and the resident reports she's also attending a vocational program 1 day a week, and she's happy with the new schedule. Next slide. The complainant is the resident. The complaint is G01 activities. The disposition is 01 partially or fully resolved, and there was no referral made. So our poll question to you is, was the complaint verified? Okay, great. Katie, can you share the answers? Thank you. 62% said not verified. And next slide. Not verified is the correct answer. The investigation revealed that the complaint was not factually true. The provider was not purposely restricting the resident's access to the center. The ombudsman was able to work with the resident and provider to establish better communication and also facilitate increased community services and supports. The ombudsman suggested the resident speak with her caseworker, but did not make a direct referral on behalf of the resident, and the resident was happy. Okay. You can go to the next slide while I just double check the questions. Thank you. All right, I don't see any yet about that one.
Amity, I want to address a question. It's about referring to another agency. And the question is, what if a referral is made to another agency by the facility or the resident themselves? That's a very good question. And I think that what it comes down to is, was that referral part of resolving the complaint? So if you, say, met with the resident and they had already kind of made their own self-referral, you would not count that as a referral. You know, it was already done, or the facility already did it. So you might document in your case notes that such and such agency, that there was a referral, but your program didn't make that referral. So we're trying to get at the actions of the Ombudsman program specifically. So I hope that clarifies.
Thanks, Louise. So I did see a question. It said the complaint was that she did not get to attend, and it was confirmed that she did not attend. So I hear your point about that, but actually scenario 8, the complaint was that the home's provider will not let her go to the activity center. So yes, you're right, she wasn't going, but the provider wasn't restricting her access. So that's the very, very subtle difference. Okay. All right, so let's go to the next scenario. Thanks, Katie, for already having that up. A nursing home resident who is receiving hospice services complains that he's in a lot of pain. He says the facility refuses to contact his doctor about changing his pain meds. You ask the director of nursing to consult with the doctor. She agrees and calls you the next day to report that the doctor made a minor change in the medication dosage. You visit the resident, but he's asleep. The nurse on duty relates that the resident has been much more comfortable. 3 days later, you visit the facility to see the resident again, and unfortunately, the resident or the director of nursing tells you that the resident passed away the night before. Next slide. The complainant is 1 for resident. The complaints are F06, access to health-related services, and F07, symptoms unattended. Both complaints are verified. The disposition for F06 is partially or fully resolved, and there was no referral made. So what is the disposition for F07, symptoms unattended? If you could launch that poll. So we're just asking about the disposition for that one complaint. Okay, if you can share the results. 70% said partially or fully resolved. Next slide, please. And that is the correct answer. In this example, the facility initially refused to contact the resident's physician. However, at the Ombudsman's request, they contacted the doctor and the nurse adjusted the meds, resolving the complaint. The nurse on duty reports the resident appeared more comfortable during the day, and the Ombudsman observed him sleeping. Unfortunately, the resident died before the investigation was final, so the Ombudsman had to make a determination regarding the disposition based on the facts available. In this example, there was some evidence of partial resolution due to the adjustment of medication and reports from the nurse on duty. Okay. All right, Katie, go ahead and go to scenario 10, and then we'll see if there's any other questions that trickle in. So scenario 10, a daughter calls complaining that her mother is not bathed as often as she should be. She does not go to the senior center very often, and she has to share a room at the residential care community. You visit the resident and observe that her skin is very dry, and she reports that she dislikes taking a bath more than a few times a month. She has little interest in going to the senior center. She likes gardening and is outside in the garden when the weather's nice. She enjoys having a roommate. She's happy at the residential care community and is aware her daughter is not satisfied with her care. So the complainant is the resident representative, family, or friend. The complaint codes are CO4, room issues, FO5, personal hygiene, and GO1, activities. The complaints are O2, not verified, and there's no referral made. So our question to you is, what's the disposition? Again. Okay, go ahead and close that. Thank you. So 89% said withdrawn or no action needed. Next slide, please. And you are correct. And I think it's very clear that the daughter made several complaints. However, after talking to the resident, the Ombudsman finds there's that the resident doesn't agree with her daughter's complaint. So again, following the resident direction, there's no action needed or appropriate. Okay, thanks, Katie. All right, I don't see any questions yet for that one. So scenario 11. Bill is unhappy with his father's dining experience in the nursing home. On a visit, you observe all residents eating at cafeteria-style tables and using plastic utensils. No one helps Bill's father cut up his food or open his milk carton, and he cannot give you direction. You and Bill work with the facility to resolve the issue. The facility purchases round tables and different utensils. They schedule several in-services that focus on improving the dining experience for all residents. Bill is happy with these changes. Unfortunately, his father dies before all changes are implemented. So for this scenario, the complainant is O2, resident representative. The complaints are HO2, dining and hydration, and HO1, food service. Both complaints are verified. A referral was not made. So our question to you in the poll is, what is the disposition? Okay, looks like a lot of folks have responded, so we can close that. Thank you. 91% partially or fully resolved. Next slide, please. And that is the correct answer. Unlike example number 9, the resident cannot give the Ombudsman direction. Therefore, when closing the complaint, closing and working on the complaint, the Ombudsman takes direction from the complainant. So even though the resident died before all the changes were implemented, the son, the complainant, was satisfied with the outcome. Both complaints are resolved and the case is closed. All right, Katie, go to scenario 12 and I'll check the questions. Okay, scenario 12. A resident complains that only one alternative meal is offered at dinner. He would like at least 2 options. He'd also like a big screen TV in the lounge closest to his room. You accompany the resident to help him share his concerns with the administrator. The facility refuses to purchase a TV with a larger screen. They maintain the lounge near his room as too small a space for that big TV. The home agrees to have 2 alternative meals during the week, but cannot offer 2 on the weekends. The resident is satisfied with the alternative meals during the week, but he's not happy about the TV. Next slide. The complainant is the resident. The complaints are HO1 for food services and GO1 for activities. Both complaints are verified. Complaint HO1 food service is partially or fully resolved, and a referral was not made. So our question in the poll is, what is the disposition for the GO1 activities? All right, majority have responded. We can go ahead and close it. 80% not resolved. Next slide, please. And you're correct. The correct answer for the disposition of the complaint regarding activities is the TV is not resolved to the satisfaction of the resident. As you could see, there were 2 complaints in this example. The facility addressed the first one, but did not purchase the larger TV, and the resident was not satisfied with that. Thank you. All right, so scenario 13. You notice a bad smell when visiting a residential care community. The RCC had plumbing problems in the past and the owner was slow to resolve them. The owner's on the phone, so you can't talk to him. The residents are upset with the smell and tell you a toilet may have backed up again. They blame the owner. The staff person you talk with does not know what's causing the odor, and you open a complaint against the facility. Returning the next day, you've learned that the city was repairing a gas line behind the home and ruptured a sewer pipe. You do not smell any odors. After speaking with residents and staff, none report a problem. You conclude the broken sewer line was the cause of the problem and close the complaint. Next slide. The complainant is O3 Ombudsman Program. The complaint code is IO2 Environment. The disposition is withdrawn, no action needed. A referral was not made, so O6 is the code. The question in the poll is the complaint verified? Okay, go ahead and close that. Thank you. This one's pretty close, actually. 58% say not verified, but the others said verified. Next slide. And the answer is actually not verified. So residents did complain about the smell, and the Ombudsman noticed the smell when they entered, and they confirmed there was an odor, but the cause was from an outside source, not because of facility negligence. Therefore, the resident's assumption about the complaint was not verified because they assumed that it was a plumbing issue and that it was the facility's fault, not whether or not there was an odor. The problem resolved itself and required no further action. This is a really good example of a complaint that was addressed really quickly and was found to need no action needed, but was still a complaint that required some Ombudsman program action and investigation initially and needs to be documented as a complaint. When documenting complaints, just as a reminder, and training representatives about the complaint investigation process, please remember that no matter how long a complaint investigation takes, even if it's open and closed on the same day during a visit, it required Ombudsman program investigation and action, so it needs to be documented as such. Okay, next slide. I'm going to check the questions. Okay, we have some disagreement and we hear you about whether that's verified or not. So all I can say, and Louise, feel free to chime in, but again, verification is about the initial facts as presented to you, and the residents were complaining that the facility caused the odor or didn't address the odor, not that it smelled or not. And so that's why it was determined as not verified. Louise, any feedback on that one? Because we have some folks on the line saying that just because there was an odor, it should be verified.
Yeah, I think it's the particulars of this example where, again, the residents said, it's the facility's fault. So it is a tricky one. I agree, that you could smell, but they're saying it's due to the toilet being backed up. So the facts are it was not yes, there was a smell, but it was not from the toilet being backed up. So therefore, that issue, that complaint, could not be verified. And that it is a tricky one. It is, it is a matter of, we've given you a tough one. But again, looking at this example, the resident said, we have a smelly toilet. Like, well, there is a smell, but it's not a smelly toilet. So I think that's kind of, we're being very literal about this. So that's all.
Thanks, Louise. Okay, so we have one last scenario, so I want to try to get through it and we can address any other questions. And again, this training, this is our first webinar series on the revised codes, and there will be additional training and support and technical assistance ongoing. So if we need to provide clarifications or if we do make any edits to the training materials or anything of that nature, you will be notified, and we will be producing frequently asked questions and hope to address many of your questions and concerns. So scenario 14, a resident calls asking for your help in fighting a discharge notice. She says that she's forced to move. If she's forced to move, it'll be her third nursing home in 2 years, and she wants to stay where she is. You assist her in filing an appeal, reviewing the notice, and beginning investigating the issues. The facility is not willing to review the resident assessment, care plan, or discuss any other options. You know the local legal services provider has represented other residents in the fair hearing process. The resident's eager to have you make a referral on her behalf when you tell her about the hearing. You contact legal services and they agree to take the case. The hearing officer rules that the resident can remain in the nursing home. Next slide. So in this situation, the complainant is the resident. The complaint code is CO3, discharge or eviction. The complaint is verified, and the disposition is partially or fully resolved. So our question in the poll is, to whom was the referral made? So please select the correct answer. And again, we could only show 5 of the 7 referral agency codes. Okay, we can close that. Thank you. 93% said legal services. Next slide. And you are correct. That answer is legal services for the referral agency code. So I am going to go to our questions panel now. And again, we hear you on scenario number 13. We had several comments about that, and we agree it is tricky. But again, we were being very literal in that that case and discussion. But we will definitely take your feedback under advisement. So thank you. All right, Katie, if you want to go to the questions slide. Thank you. So I'm not really sure of this question, so I may need clarification, but it says, would the referral agency code would 04 be considered DDSN boards? And I hate to admit this, but I don't know what DDSN board is. Developmental disability something, I'm not sure. But again, the referral agency code 04 for protection and advocacy could be called a variety of things in your states or even local areas, but it is the advocacy organization for individuals with disabilities. So that may or may not answer your question, and I apologize for that. But if not, you can contact us offline, just because I don't know what that acronym is.
Amity, someone wanted to look at the answers to question 8, I believe it was, if you want to just maybe post that up for a minute. Katie?
Scenario 8, I assume this not verified or the verified part, or the other answers?
I think the answer, just all the answer for everything. I'm trying to find the question now.
So that was about the not being able to go. The complaint was that the residential care community was not allowing the resident to go to the activity center every day as she had previously. So was there a question about the answers, or you just wanted to see the answers?
I think somebody just wanted to see it.
Oh, okay.
So I thought since we're, and I'm trying to make sure that was the right question, but I believe it was.
So thank you. So a question, it's not really a question, but a statement came in. Encouraging self-resolution isn't mentioned in any of the scenarios. I thought we were supposed to do this first. And that's a great statement. So thank you for sharing that. The reason that self-advocacy really isn't present in these scenarios is simply because the focus of this one is cases and scenarios that require Ombudsman program investigation, at least at some, to some extent, in order to help figure out how to code those activities. Because if it was self-advocacy, then most of that would be consultation, providing information about rights, and advocacy strategies to the resident or the family member. So that would actually fall under consultation or information assistance, which was a previous webinar. So good question. Okay, so number 14. Katie, if you could go to 14. The question was, why wouldn't it be the referral agency 01, licensing, regulatory, or certification? And that's because the Ombudsman program referred it to legal services, so legal services could assist with that appeal hearing. So good question. Okay, I'm going to see if there's one more that we can address right now. And Louise, feel free to jump in if you see one you think we need to address. And then I'll wrap up with the final slides. Okay, so one question was regarding the comment that you made about a case being open and closed in the same day, still needing documentation. Had the Ombudsman been made aware of the sewer break before she left and told the residents it was a sewer break, would that have been a consult and not a case? That's a good question too. And Louise, if you disagree, please let me know. But I would see that still as a case because it was an initial complaint. The Ombudsman took action to find out it was a sewer break and inform the residents before she left. So even though that was resolved on that same visit and not the next day, then that would still be a case and not a consult.
Yeah, I would agree. And I think this gets to that idea of it's okay to have complaints that, you know, get resolved quickly, maybe weren't verified. It starts to build kind of the story of the facility and the residents and what's going on there. So it's okay to have complaints that either weren't verified but you still worked on because you're supporting the resident. That's really important. Also, sometimes we know family may have complaints and the resident might say, I don't want to make any waves, even though they know it's a problem. It gives you that insight to know there are some problems here. Maybe this resident won't take action, but you know, it gives you something to go on in terms of if other residents raise those same issues. So it's important to get that information and to frame it as a problem.
Thanks, Louise. And just one last comment, and just want to say thank you. A comment that they like the 3 disposition codes instead of 7. So thanks for sharing that. It's nice to know the changes that you do appreciate. So keep them coming in, and hopefully as you keep using these training materials, we'll continue to hear from you so we can address your questions. So go ahead and head to the next slide, Katie, the one that kind of has the, yeah.
And
thank you.
Amity, I was just going to say one more thing. Somebody requested more kind of training examples and questions, and so yeah, I think we'll work on that. And also maybe, you know, we tried to keep these pretty straightforward, and we're trying to be very literal, but maybe we need to even have some that are even less complicated to help kind of see the, you know, to kind of help guide you. So we'll work on some more follow-up materials. And so,
yeah, that'll be part of our ongoing work. Not to say that we'll turn around in a couple weeks with 50 new cases. So just as far as expectations go, we will be working on this, and this will be an ongoing process, and we'll try to push out new information as quickly as we can, and be as thorough and helpful as we can. So, and just another kind of highlight, I hope you're all receiving the Ombudsman Outlook. It's a quarterly e-newsletter, and there's an entire article in each one of those specifically about NORS. And so expect to see your FAQs and other resources and just information shared and that resource as well. So keep your eye out for that. Okay, so just as a recap, we reviewed the Part 3 training materials for verification, disposition, referral, and closing cases, and we took the quiz and had some time for questions. And as I said earlier, we will continue this training. This isn't just a one-time thing. We'll keep providing information and support and technical assistance, and provide an additional webinar as well in the future about some FAQs. So next slide, the resource slides. Just to remind you, because we did have some questions about where to find this information on our website. Next slide, please. This is the landing page for all of our NORS information, and as you can see those bullets, it has the current NORS instructions and complaint codes and data and the current NORS FAQs. That last bullet, if you click on that and the next page, Katie, it'll take you to the revised NORS training page. So that's where all of these materials that we've been doing, that's where all of this information will live. So next slide. Just a reminder, do not start using this information and these codes and definitions until October 1st officially, because that is the implementation date of the revised NORS. And last but not least, our last webinar as part of the series is next month on the 29th, and it's over Part 4 activities. So please plan on joining that one, and keep an eye on your inbox for information that will be sent out before we go live for you to review. And next slide. And here is our contact information. Feel free to reach out to us if you have any questions or just suggestions and requests for clarification. So this is something that, you know, we're trying to, as Louise said, make this as simple and straightforward as possible, but I do think that, you know, there's going to still be some areas of confusion, and we need to know what those areas are so we can help you address those. So again, thank you so much, Louise, for your time today on the presentation and your work on NORS. And thank you all for joining us today. Please complete the evaluation that will pop up shortly as soon as this webinar is closed. And have a great rest of your week. Thank you.
And thank you, and Amity and the NORC team. Thank you very much. Okay.
Thanks. Bye.
Bye-bye.